We are not anticipating any issues around supply of the vaccine for the 5 to 11-year-old age group. People are likely aware that the Pfizer vaccine for kids or 5 to 11-year-olds is a smaller dose, and it's actually in a different vial of vaccine, a slightly different formulation. But we've been assured by, I guess, the provincial government, who's been assured by the federal government that there should not be any concerns about supply initially. There will be multiple ways that parents can access that vaccine once it is approved and once we receive direction from the province to roll it out. And that will include for some primary care clinics and then other our clinics, health unit clinics at fixed sites throughout the region, and then pharmacies as well. We do have approximately 11,000 kids between the ages of 5 and 11 across all of Northumberland County, City of Kawartha Lakes, and Haliburton County. And we are anticipating that when the province gives the go-ahead, that it will be it will kind of be everybody all at once in that age group. There won't be a tiered system the way that we saw with adults. We are working on lots of resources for parents on information about vaccine, risks and benefits, pros and cons, what we know, what we don't know, that will be available on our website, as well as multiple other organizations such as the Sick Kids Hospital in Toronto, other pediatric resources, community primary care resources. There will be lots of information available as I'm sure that parents will have questions about that, and rightly so.
Okay, and one follow-up. Just, you mentioned with the vaccine for kids 5 to 11 that it was a slightly different formulation, and I'm wondering, is that the formulation that was tested in the 5 to 11?
It would be the same that was tested in the 5 to 11, yeah. So we're certainly having lots of ongoing discussion about the best place to host clinics for 5 to 11-year-olds. And all of this really is a balance of the resources that we have, especially kind of the human resources, needing to meet the needs of the highest number of kids as possible to see them through, and then other space limitations, that sort of thing. So we're continuing to discuss with school boards and primary care which sometimes looks differently across the region, what the best approach is. So at this point in time, we don't have any in-school clinics scheduled, but we'll continue to reassess on an ongoing basis.